Hey, hello wonderful people. So we're back with a new episode. Like we said in the last video, we're going to be making 3 episodes of breast cancer awareness, and this is the second episode. And we're glad to be here again with you guys. And as usual, I'm Dr. Onyinye, and with me is
Dr. Celestina.
Today we're going to be continuing from where we stopped in the first video. So today we're going to start by talking about the symptoms of breast cancer. Okay, we've seen the risk factors, we've seen like the information, the general introduction into breast cancer, and now we want you to know the symptoms, what you should look out for, things you see that should make you worry, things that you see that should make you want to go to your doctor and ask for help. So first of all, we're going to start with the symptoms of breast cancer.
The first symptom, which is actually the most frequent, is when we find a lump or a thickening in the breast area. Not just the breast area, but in the areas close to the breast area and your armpit region. Sometimes you could feel either a lump, which could be painful or without pain, or sometimes you can feel a thickening, like something really strong, which is different from your normal skin consistency. And it's not just in the breast area. You could also find it areas close to your throat or your armpit area. So it's very important for us to look out for things like that, so that we can try to look for medical attention.
Another symptom that we need to look for is the size or the shape of your breast. Okay, generally both breasts are supposed to have the same size, the same shape. There is this general notion that one breast is always like slightly bigger than the other one, which is absolutely normal. Okay, but when you see a very huge difference, when you see that one breast is actually getting bigger than the other one, you need to worry. And even if it's not the size, probably it's the shape. If one of your breasts begins to change its shape, begins to change its form, you need to start worrying and you need to see a doctor.
Yeah. The next symptom is actually dimpling. Well, we all know what dimples are, but not just the dimples on the cheeks. You can also find dimples in your breast area, right? Dimple is actually, well, a depression in the breast area, like as if something is sucking your skin inwardly, or it could actually be a bump. So this feature is actually a depression or an elevation in your breast area. So when you see something like that, you have to try to check that out as quickly as possible.
Another symptom that is also very important is the nipple retraction. Okay, as women, we all know how our nipples look like. We know what our nipples are supposed to look like. So when you begin to see that your nipples are beginning to fold inwards, they are retracting inwards, then something is not okay. So you need to check that out also. Okay.
So the next symptom is discharge. Now, what is discharge? Discharge is actually when a fluid or a liquid substance starts coming out from your nipples, and this discharge could be milky, it could be yellowish, or it could be bloody. So when you notice something abnormal like that, please try to see your doctor.
Another symptom that could actually appear in people who have breast cancer is a dry skin of the breast area. It could be red and it could be swollen. But basically what you have is like a very kind of dry, reddish skin. When you see something like that, it is very important for you to speak to your doctor.
Another symptom is having a change in the texture of the skin of your breast region. Now, you know what an orange looks like, right? The skin of an orange, how it feels like. That's exactly how your breast feels like, because it has like little depressions all around it, making it look like the skin of an orange. So when you start to see such changes in texture in the skin around your breast area, please contact your doctor.
There's also a type of breast cancer which is called an inflammatory breast cancer, which doesn't necessarily appear as a lump or the symptoms we've described. Most times it will appear as itching. Okay, it could appear like you start feeling like you have an irritation on your skin. It's like when you've had contact with something that irritates your skin and you begin to itch. That's how it feels. And sometimes people might mistake that as an allergic reaction to something, but most times it's actually a sign of breast cancer. Any kind of thing or any kind of symptom you notice on your breast that is not normal, we all know what a normal breast looks like. Anything that you see in your breast that is not normal, please don't just overlook it. Talk to your doctor, please.
Now, there's another stage of breast cancer that we call metastatic breast cancer. In medicine, we have this word called metastasis, and it means when the cancer spreads from its initial point to other parts of the body, like your liver, your lungs, your kidneys, your bones, your intestine, etc. Sometimes it doesn't cause symptoms, but when it does, the symptoms you actually show depends on the organ that is affected, right? It could affect your bones, causing pain, fractures, or sluggishness, right? Due to high level of calcium in your body, because we know that calcium is the main component in the bones. So when the cancer starts to eat into your bones, it starts releasing this calcium into your bloodstream, causing that decrease alertness. It can affect different organs in your body system. Now, it can actually affect the lungs too, because we know that the lungs are very close to your breasts too. So that is actually the first organ that the breast cancer affects when it starts to spread, right? So when the cancer gets to your lungs, you start feeling difficulty in breathing, persistent and frequent coughing, tiredness, because of the invasion of this cancer in your lungs. So another organ that can actually affect is your liver, causing nausea, which is this feeling like you want to vomit. It can actually cause tiredness. It can cause a yellowing of your skin or your eyes, and it can cause you to have itchy skin. So these are the symptoms that you could present when the cancer affects your liver. Now, another organ which is also very important that breast cancer can affect when it spreads is your brain or your spinal cord. And when the cancer gets to these organs, you start to experience something like confusion, headaches, you start to experience memory loss, difficulty in speech or movement, or even seizures like shaky daddy convulsions. So those are like the symptoms that you can show when this cancer spreads to your brain or your spinal cord. Now, screening methods. What do I mean when I say screening? Screening method is actually a method that we use to diagnose breast cancer or other kinds of cancer, but in this case breast cancer. And the first screening method that is usually carried out on the patient is a mammogram, right? In an ideal situation, every woman from 35 years and above is supposed to do a mammogram once a year. But because of factors such as high cost, availability, and accessibility, this goal has been hindered greatly. So, but generally, every lady from 35 years and above is supposed to do a mammogram once a year. This mammogram is like a method of, is like a way of carrying out a routine checkup on the patient, and it's also used to do the initial screening for breast cancer. So when you notice some abnormality in your breast tissue or your upper chest region or your armpit, and you go to the doctor, the first exam they'll do for you is a mammogram. Now, we have other techniques that we can use for further studies, such as the ultrasound, which is used to check if the lump is actually a solid or a cyst. And we have the MRI, which is used to check if the cancer has spread to other parts of your body. And we have the biopsy, which is more aggressive, where they take out a piece of that abnormal tissue and they send it to the lab for analysis. So these are other procedures that can be carried out on a patient to further check to see if the patient has breast cancer or not.
We're very sure that most of you have been waiting to find out what the relationship between men and breast cancer is. So here we go. 1% of men have breast cancer. Yes. Even though we think breast is a female thing, men also can have breast cancer. Now, of this 1% of men that have breast cancer, black men have the worst prognosis of breast cancer. It means that if a black man gets breast cancer, the result or the outcome of this breast cancer is worse than men of other races. Okay, so this video is not just for women, it is also for men because they are affected too. Okay, also studies have shown that although men are less likely to have breast cancer in comparison to women, when men have breast cancer, they are more likely to have an advanced stage of breast cancer. Why is this even possible? This is because basically we live in a society where men are not allowed to show weakness. Men are always supposed to put up a brave front. So if a man starts having some kind of symptoms, starts feeling some weird things on his breasts, the male breast, he feels ashamed to come out to ask for help or to speak about it because of how society has labeled men to always be strong and never show weakness. And now because of this, these men keep quiet and these symptoms continue to advance. By the time the man can no longer stand the symptoms, it's already too late because this breast cancer has advanced to a really critical stage. Why do men even have breast cancer? I'm sure most people are wondering if breasts are for women. That is because when we are born, both a female child and a male child, we all have breast tissues. Okay? When we get to puberty, the females begin to release a hormone, which is estrogen, that helps the development of their breast and other sexual organs. While the male child releases testosterone during puberty and helps him to also develop his sexual organs. So even though at puberty, women are the ones who develop the breast, from childhood, both female and male children are born with breast tissues. And so that's why men can also have breast cancer. What are the risk factors for men? The risk factors for men are practically the same as women. So we have exposure to radiation, be it because you're working in a place that exposes you to this radiation, or because you go to the hospital and you ask for unnecessary exams that expose you to radiation. Also, genetic mutation, like we explained in the last video, can expose the men to breast cancer. Family history. If a man has a sister or a mother that has ovarian cancer or breast cancer, he is also likely to have breast cancer. Obesity, like we also mentioned, increases their risk for breast cancer. Diabetes mellitus type 2 also increases their risk for breast cancer. Testicular disorders. When we talk about testicular disorders, we're talking about any kind of malformation or disorder within the sexual organ of the man. So what happens is that when there are these disorders, the man can have an imbalance of hormones, because both male and female, we all have estrogens and testosterone. Women have estrogens and testosterone, but we have more estrogen than testosterone, and the men have both, but they have more testosterone than estrogen. So when a man has testicular problems, there's an imbalance of hormones, and so his production of testosterone reduces drastically, making him to have more estrogen than testosterone, and so he can have more risk of having breast cancer. As we said in our last video, estrogen is one of the hormones connected to breast cancer. Another risk factor that men have is what we call gynecomastia, okay, which is actually men that have boobs. Yeah, they have big breasts like women. Okay, and it's the same thing. It's because in these men they have more estrogen than they have testosterone, and so since the estrogen's work is actually to help a woman develop her sexual organ, which include the breast, it does the same for the man, and so the man comes out with boobs like a woman. So because he now has boobs like a woman, he also has the risk of having breast cancer. Okay, and the symptoms are practically the same. The symptoms we've mentioned for the women are the same symptoms that the men will present. So if you're a man and you present anything like lumps, or your nipples begin to produce discharge, bloody, yellowish, whatever it is, or you start having dry skin, itchy skin, please and please don't try to say, I am a man, I can't stand it, I am fine. No, please.
You are not fine.
You are not fine. It is not normal, my brother. So if you feel anything weird, just go. No, nothing will. It won't stop you from being a man. Okay, please. We need the men in the world.
Yeah.
Please, we need you guys to leave. Okay, so please, this is really very important for men and women.
The next thing we're going to be talking about is prevention. Now, how do we prevent breast cancer, or how do we reduce risk of getting breast cancer? The first is diet. Now, when you have a high fat intake, you increase your risk of getting breast cancer. Now, if we were to reduce your fat intake from, let's say, 30% to 20%, this helps in the reduction of your risk of getting breast cancer.
Another way to prevent it is exercising. We've mentioned that sedentary lifestyle is a risk factor, so you need to exercise, you need to move. You don't necessarily have to go to the gym, but try to take a walk. Okay, walk like every day, 5 days in a week, 30 minutes. Just walk, just move. Don't sit down in one place. Try to be active. Okay, because that is really very important for your health.
Now, next is breastfeeding. Now, I cannot emphasize this point enough, because breastfeeding has a lot of benefits both for the mother and for the child. So one of the benefits of breastfeeding is reducing the risk of breast cancer, because when you put your breast to good use by breastfeeding your child, you reduce the risk of accumulation of all that breast milk and all that breast tissue, and then which can actually cause a problem for you in the future, in this case breast cancer. So please, mothers, breastfeed your child.
Biko,
I beg.
Another way we can prevent breast cancer is by reducing our alcohol intake. Okay, Nigerians, we like to jolly, we like to party,
too much enjoyment.
I'm there everywhere,
every Saturday.
So, but really, on a serious note, we need to reduce our alcohol intake, because that will really help us. That will go a long way to reducing our risk of having breast cancer.
Another way we can reduce the risk of getting breast cancer is actually reducing the frequency with which we smoke. If you're a smoker, you know the risk, the health risk that you are exposing yourself to, and breast cancer is actually one of those risks. So we know that when we smoke, there is actually accumulation of toxins in our body, which can affect our immune system, which is responsible for our protection. So if you stop smoking or reduce the frequency with which you smoke, you automatically reduce the risk of developing breast cancer in the future.
Another way we can prevent breast cancer is treating every benign breast disease that we have. So sometimes you have symptoms in your breast, and that's why you need to go to the hospital. It's not cancer, it's actually something else that is benign, that is not as malignant as cancer. So those things are really simple things to treat. And don't, because it is simple, say you're not going to pay attention to it. If you don't treat these benign diseases, they're going to continue to practically evolve until they get to the stage of cancer. So any kind of thing you have in your breast, just make sure you go to the doctor, and if he says this is what you have to take to treat it, please take it. Let's avoid problems, please.
And the last prevention method is, well, reducing your radiation reception. Like when we go to the hospital for one condition or the other, sometimes we might want to suggest to the doctors on which procedure we are going to receive, we should receive, such as maybe X-ray or other procedures involving radiation. So when we reduce the amount of radiation that we receive, we automatically reduce the risk of getting breast cancer. Now, just like a motivational quote, which I would like us to think about, we're all used to this expression that says knowledge is power, but a wise man once said that knowledge is not power. Shocker, right? Knowledge is potential power. Action is power. So, because when you gain knowledge, you don't actually create anything unless you put into practice that knowledge that you've gained. So, I hope that we've decided to take action today. And if your answer is yes, I have decided to take action today, then watch out for our next video.
Okay, so we just want to say a very big thank you, and we want to use this opportunity to reach out to those women who are battling with breast cancer. Yeah. We see you, we support you, we love you, and we're really proud of you for actually being positive and trying to fight this deadly disease. And so we pray that God sees you through. And yeah, today we're wearing pink to show support to all the women living with breast cancer and all the survivors of breast cancer. You guys rock. You really do.
You guys are the real MVPs, really.
Yes. So like, God is your strength. Okay.
You're not alone. We're with you.
We are all together.
We're all together. Yeah.
Okay. So next week you're going to be getting something really special. Like, this is really special. Okay, so we're actually going to be doing the breast self-exam because we want all our viewers to know how to examine themselves. So maybe some people have tried, but they really don't know how to really examine themselves. So we're going to be making the next video. The next episode is just going to be a video of us doing the breast self-examination. So make sure you don't miss out on this, because you need both the men and the women. Men, you have heard that. So you too, you need to do your breast self-examination. Okay, so please don't miss out on this. Okay, don't miss out on this, because we're going to show you how to examine yourself, and that's where you could actually help yourself. And that's actually the whole idea of this breast cancer awareness for early diagnosis, because when it's diagnosed early, treatment is easier and survival rates are really high, as opposed to when it's diagnosed late. So the breast self-exam is like really important. So please don't miss the video. Okay, please, pretty please. Okay, so thank you for watching. Please don't forget to subscribe. Please don't forget to share the video, like the video, leave your comment, ask questions. Anything you want, we're here really, we're here for you. So thank you for all the support. Every week you guys surprise us, and like it's just surreal. So bye, see you next week.
Until next week.
Ciao.